The public health crisis of the COVID-19 pandemic is affecting everybody in the world. It has an especial impact on anybody who's dealing with substance problems. Today, we're going to break this down from the point of view of alcohol problems and tying together the spectrum of alcoholism and to shed some light on some of the stories that we have heard in recent months connected to treatment and people who are looking at drinking within their life. This includes people who are new to recovery, people who are at risk, people who have stable recovery and now are vulnerable for relapsing or falling back into drinking. And I'm also going to comment on a lot of everyday people who are dealing with their life and stress, and they might have an elevated amount of drinking, and what are some of the health ramifications for that. As always, I'm Pat Fehling as part of the University of Colorado and the Center for Dependency, Addiction, and Rehabilitation. We are here to help. This can give a framework to you to understand that you're not alone and you may be dealing with scenarios connected to COVID and your personal life that other people are dealing with as well. There is help. The COVID-19 public health crisis is affecting people on many different levels. We think of the tragedy connected to the virus itself, but in our world of behavioral health, we are anticipating that the traumatic effects of COVID-19 are going to affect our society for the next coming years. It's important to start a dialogue about this and to provide some education around what we're looking for as treatment providers and also what you can look for as an individual or maybe a family member of a loved one to know warning signs and to look at this from the interplay between drinking patterns and this public health crisis. We're really talking about stress. This is a huge stress load. When people are dealing with chronic stress, how can that affect people and their health? That most often causes danger to people. There are some people who are very resilient to stress and will bounce back quite well. We look at drinking really on a spectrum, and it's important to know that even people who have full alcoholism or alcohol use disorder, we even stratify this as either a mild, moderate, or severe problem. So on one side of the continuum, we talk about safe drinking patterns. This is really for men, you're talking about an average of 14 drinks a week, and for women, you're talking about an average of about 7 drinks a week. Anything above that falls under at-risk drinking. Problematic drinking is where people's alcohol is starting to cause some sort of a consequence. So the consequence could be early signs of a health problem, maybe a DUI arrest, problems with work or other conflicts. And then across a very important line, we use this for medical purposes, is the concept of what we call alcohol use disorder. And over time, with escalated drinking and the progressive nature of this, people can move closer and closer to the line or even cross the line into full alcoholism. There are very different styles of individuals that we've seen in delivering treatment to people during this time. And this is what we're going to expand on and almost provide a little bit of a snapshot of potential scenarios, and this might apply to you directly. We care a lot about somebody in very early recovery. So the new recovery patient, this is somebody who is either receiving treatment right now during the pandemic or right before and they're newly sober. How does this impact them? For some people, during the crisis, it can make it very difficult to even find treatment. Fortunately, at the University of Colorado, we are fully open, including active residential care. That's been very useful for people, especially dealing with isolation and their drinking might be completely out of control, to know that as a health center, we really can meet their needs, and I think that's very powerful. We also have expanded the use of virtual health, and I think that this is going to change addiction and behavioral health care across the country indefinitely, is embracing the usefulness and the strategy around virtual health or telehealth care. We do find some people who are newly sober and they start losing momentum. They are returning to their life, and they're getting discouraged, and it can be very easy to fall back on old patterns and relapse. And so we have seen this quite a bit. So a lot of this has to do with understanding and appreciating the vulnerability that you may have in your early recovery. We've got another person, which is somebody who is actually in stable recovery or maybe long-term recovery, and now it gets jeopardized in some way. They have a recovery community. A phrase we use often in treatment is the opposite of addiction is connection. And when people feel isolated, alone, or dealing with a huge stress burden, there are many people who are going back into drinking. Their recovery is starting to show cracks in it, and they're vulnerable and they're not doing well. This is a very common problem. The peer support network, and there's many different styles of peer support. Oftentimes people think about Alcoholics Anonymous. That is just one example. There's a few different peer support avenues for people. Now people are having to use more virtual options, so they're doing video conferences and other things to maintain social distancing along with that. So that really can be a disruption to somebody's overall recovery program. We think of core relapse triggers, and there's a lot of relapse triggers that are present right now. And a really good acronym for this is HALT, somebody who is hungry, angry, lonely, or tired. And I think that this will resonate with many people who are dealing with the COVID pandemic. How many, or if maybe all of these things you might be dealing with. Each of these is a trigger, and they can be additive and magnifying in terms of placing somebody at risk to go back out and to return to their drinking patterns of the past. I'm really curious about how many people during this stretch of time are going to develop a new problem with alcohol. And these might be people who are more heavy drinkers who crossed some sort of an abstract line into full out-of-control alcoholism, or people who were more everyday drinkers and their drinking patterns doubled. And there's different reasons of why that might happen. There's an overall elevated risk that we have. And what are some of the basic risk factors that we see during the COVID pandemic? We think of some of these. Somebody might have lost their job. They might have been fully laid off, or they might be on a furlough. There's a lack of structure. They might have a lot of downtime. They might feel very isolated or even emotionally isolated in their life. People who are dealing with parenting, raising young kids, it can be massively overwhelming, and it can create a very significant stress burden for somebody. We focus on the health itself, and this could be anxiety around keeping yourself safe, or the vulnerability of contracting the virus, or possibly the health trauma of maybe a loved one who came down with the coronavirus infection, or the greatest tragedies is somebody who's had grief and has lost a loved one, or a loved one has passed away. And then I think all of these things, we add them all together, and it can make drinking seem more useful. Drinking helps us cope. We feel like we can use alcohol to decompress, and drinking patterns can really go up during this time. And we've been seeing this in treatment. I think it's important for any listeners to know that this is a risk and we need to appraise it. What are the core signs and symptoms of alcoholism itself? So if somebody were really across the line in terms of what we would diagnose as alcohol use disorder, we look at symptoms including tolerance of alcohol, withdrawal symptoms, which is the nervous system kind of being agitated when we take the alcohol away, the loss of control around drinking. You set out an intent or a plan in terms of how much you were going to drink for the night, and it turned out to be double that. the drinking keeps going even though it's causing harm. So people are struggling and they just keep drinking through it. And then we also focus on cravings. Are people really having very strong urges or almost compulsive urges, like they need a drink, they need a drink? This can all be very vulnerable. It could be markers of early signs of somebody developing alcohol use disorder or alcoholism. I think it's important to know that even for people who don't develop a full alcohol condition, there is data around the volume of alcohol consumed and does it pose an overall health risk over the course of one's life. Some of this is actually drawn from a British journal that's called Lancet in a 2018 study. This was a population study that looked at more than a few 100,000 people in Europe and tracking alcohol volumes with shortened life. And they basically found that no amount of alcohol seems to be completely safe. This is complicated. In the early 90s, there were messages in the area of you should have a glass of wine, or moderate drinking was actually good for your health. And there is a little bit of benefit from things like red wine in terms of blood pressure and cardiac protective benefits, but that seems to be offset for men and women in the topic of cancer. And so this is a little bit different than just somebody developing compulsive drinking patterns. This is looking at overall aggregate alcohol consumed over your life in higher rates of cancer, higher rates of other physical issues that could overall shorten your life. And I think it's important to know that our lives are, it can be difficult to make decisions around what might be so far in the future. And that, what I mean by that is, if you're in your 20s or 30s or 40s, talking about a few years worth of life expectancy might not seem like a big deal now. It's a little bit of like, we need to just get through this pandemic. We need to get through this stress. I'm really curious in terms of, if people show a spike of elevated drinking over this time, will that stay that way? Connected to the stress, or when we get through this and everything around the pandemic starts to pass and the science and the health community, we all adapt and life starts to move back to normal, will the drinking soften? Will it settle back down, or will it stay at a higher notch? If it does, that's going to pose long-term health risks. And from the Lancet study, it showed that when people were drinking on average 14 drinks a week, it shortened somebody's life by about 6 months on average. 21 drinks shortened it by about 2 years, and 24 or more drinks per week, which seems to be more of the market heavy drinker that could include somebody who's drinking even massive amounts of alcohol. They're on average shortened by about 4 years. I want to finish up with this topic of hope. I have seen patients that during the COVID pandemic and everything going on with the quarantine have felt reasonably grounded. It has galvanized them, including people who are in early recovery, to have gratitude for their family, to focus on priorities, to kind of bolster their commitment in terms of making changes and trying to build a better life. So there are strong, hopeful avenues for somebody. This is not all entirely grim. I think it's important to know that there is a spectrum approach in terms of different things that we're seeing. People who are struggling very significantly, people who are more in this risk component and appraising risk, and then a few people who are actually quite a bit better in terms of this has really motivated them to make changes and to stabilize their life. And that also speaks to themes of gratitude and priorities in terms of loved ones. So there always is some avenue for hope, and I think it's important to comment on that. Thank you so much for joining us for this discussion regarding alcohol patterns and risk connected to the quarantine and the COVID-19 pandemic. This is a really unstable time for a lot of people and a lot of society, As a healthcare provider, we're watching it really closely, and we're trying to do the best we can to make a difference with our patients. If you are very much struggling, reach out for help. This can require emergency care if you need it. It can require medical detoxification and support. Once again, I'm Pat Fehling. I work at the University of Colorado and the Center for Dependency, Addiction, and Rehabilitation, and we can bring people in. We have the capacity to meet somebody where they're at. And always be mindful of, if you consume alcohol, where you fall into the spectrum. What is your stress like? How are you coping? How are you dealing? So that we can help people keep a mindful eye regarding their health and to try to keep themselves as stable as possible for when we get through this and we come out on the other side. Thanks, guys.